Welcome to 180 Boom, a podcast following Alvis, an award-winning no-profit organization headquartered in Columbus, Ohio, who has been making a 180-degree impact in the community for over 50 years. Here, you will hear about the outstanding work helping individuals and families turn their lives around. Alvis' vision is for communities to value a person's potential rather than their past. Tune in once a month to hear about the empowering life-changing programs, services, and stories of second chances, hosted by members of our creative team here at Alvis. Today with us we have Dr. Shively, connected to Alvis through employment for more than 30 years. Hello, Dr. Shively. Thank you so much for joining us.
Thank you. Glad to be here.
So to start off with your story with Alvis, could you share with our listeners how your career path has been?
Yes, I've been with Alvis almost 30 years, as you said. I'm a licensed psychologist in the state of Ohio. My title at Alvis is Director of Research and Clinical Development. Some of my credentials, I'm also a chemical dependency counselor. And I've spent a lot of time on treatment committees at the American Correctional Association over the years, on the Behavioral Health Committee, which subsumes mental health problems, Substance Disorders Committee, and the Health Committee. So I've got a national perspective on a lot of treatment issues regarding corrections.
Thanks for sharing. Now let's move on to our topic of today's episode, men's health. Let's start by discussing a bit of what are some of the most common myths about mental illness. Can you tell us about that?
Sure. And I think it's important with this topic with myths for men to realize we got to get beyond the stigmas and the myths. We got to educate ourselves and realize that men and women, both in this country, have mental health issues. And it's not shameful to have an issue. It's just like any kind of health issue, you got to address it to feel better. So let me state some of the common myths, and these were taken from the National Alliance on Mental Illness, or NAMI, National Alliance on Mental Illness. I thought some of these seem relevant to today. The first myth is you're crazy. You have mental illness and you're crazy. Obviously, that's not true. But it just means when you have a mental illness that you have a vulnerability, just like somebody that's vulnerable to diabetes. If they don't do preventative measures, they may get the case of diabetes and then have to be in a different lifestyle. With people with mental illness, often their moods and thinking are affected, but they're still a human being, just like anyone susceptible to illness. A second myth. People with mental illness are violent. Hate's not a mental illness. Only 5% of violent crimes in the United States are caused by people with mental illness. Actually, it's not mental illness that's responsible often for violence, but it's actually substance abuse or substance use disorders are often the ones that get more tied in to violent behavior, not mental illness. Number 3, people with bipolar disorder are always moody, always up and down. Just not true. People use bipolar disorder as a very loose term. Bipolar disorder is an episodic diagnosis. People often have episodes of mania, which can last several weeks. Mania is when you have high energy, rapid thinking, inability to sleep, and a lot of grandiose thinking. And then depressive states, which can last several weeks. Depressive states are when you feel real sad, you might be suicidal, you have a low self-esteem. But both these poles are bipolar, ups, the mania, and downs, the depression, both can swing within several week periods. But usually when somebody's on their medication and feeling okay, they don't have any of these episodes, even though they have the diagnosis. So it's just not true that somebody's always moody if they have bipolar. It's not a moment-to-moment disease. It's something that happens episodically, usually over several week period. Next, Post-traumatic stress disorder is a military man's disease. We know with mental illness, people get post-traumatic stress, but anybody can have post-traumatic stress. A rape victim can have it, a domestic abuser survivor can have it, even witnessing somebody abusing somebody. If you've been in a household where you saw mom hit dad or dad hit mom, you can get post-traumatic stress. So it's not just isolated to somebody that comes over back from a war. They can have it, obviously, but it's many, many other situations. Okay, the next. Psychiatric medicines are bad. If I've got a mental illness and I have to take a happy pill, something's wrong with me. No, that's a myth. Like any illness, sometimes we have to take medications to feel better or restore balance. Just like diabetes. If I have diabetes, I must take a pill or my insulin, or I'm not going to be balanced. My blood sugars are going to be off. It helps somebody functionally sometimes to take medicine because they feel better. They feel more normal and they can cope better with life. They have a higher quality of life. So psychiatric medications are usually good for someone, but it's like anything. There can be a stigma attached. If I have to take a pill to feel better, something's wrong with me. And then the final myth. If I seek help for mental illness, I'm going to be labeled as a bad person or I'm in a bad way. There's a huge stigma attached, especially for men.
What factors would you say are included when discussing the origin of mental illness in men?
Okay, some of the factors involved when discussing origins of mental illness in men. First, I think we need to look at genetics. Some mental illnesses are more attached to genetic problems. There are such problems such as schizophrenia, major depression, and often bipolar. They can run in families. So second, men have tendencies to isolate, not to ask for help. And men can often use alcohol or drugs to mask their pain, to try to feel better, to try to cover up their mental illness. A study was published by the Journal of Abnormal Psychology in 2011, and it showed that men tend toward substance abuse or antisocial disorders when they have mental health problems, while women sometimes more lean towards anxiety and depression as diagnoses. Men, we have a tendency to externalize our emotions, and that can lead to aggressive, impulsive, coercive, and non-compliant behaviors. Where women, they have a tendency to internalize emotions, typically leading to withdrawal, loneliness, and depression. So men, we handle things different. We externalize, and our problems end up being more antisocial often or substance abuse related. Okay, now, men often let their aggression or crises in their life accumulate over time. And what's really hard for men is often with mental illness, it's not one event that leads to mental illness. It's an accumulation of events over years that can lead a man to be susceptible to mental illness and need help. And often they're the last to know they got a problem. Men are often reluctant to seek support or disclose to their loved ones they have a mental illness or a problem because they don't want to be seen as having a weakness, and they often act out their problems, as I said. So we rely on traditional ideas of what it means to be a man often, and that does not include mental illness. There's a lot of stigmas for men that can get them caught up.
Do you have a rough idea of how many men are affected by mental illness every year in the United States?
Well, I'm going to deal with the correction system, which I'm familiar with. And there's quite a few men in the correction system, so that's what we'll talk about. So when I say correction system, I mean jails, prisons, community corrections, operations, much like Alvis. And we often lock up people disproportionately, especially if they're Black. And that's unfortunate in this country. Often men get more help for mental illness if they're in a corrections facility than if they're in the community. We just don't have enough community resources. So our prisons and jails have become our new mental health facilities. So there's about 37% of people that are in prison, men and women, that have a history of mental illness. This is based on a 2017 U.S. Department of Justice report. And in this report, it said of those 37%, 24% have a diagnosis of major depression, 17% have bipolar disorder, 13% have personality disorder, and 12% have post-traumatic stress disorder. And the numbers get higher when you go into jails because it's a harder population because it's directly from the community. But that gives you some ideas.
What would you say are the most common mental illness that men have?
Well, what we often see, especially in correction systems, places like Alvis, where I work and you work, men often have substance use disorders. Very common to have antisocial personality disorder. And that's somebody that often has a mindset of breaking the law, and they don't see a whole lot wrong with it. Another common disorder is bipolar disorder that we've already talked about. And then we've already talked about post-traumatic stress disorder. Those seem to be the most common for men. However, there's some that are less common, but we still see them occasionally. And that would be something like schizophrenia or an anxiety disorder. We do see those in men, but they're much less common.
Why do you think there is stigma with men and their mental health?
I think there's a lot of answers to this question. But as I said early in my presentation, this stigma holds men back from getting the help they need often. And the first stigma, society. It's just society's image of a man. We see it in the media all the time. A man needs to be strong, self-determined, independent, invincible. Men just can't have a weakness and be a man. And unfortunately, like any illness, mental illness is a weakness. It is a mental weakness, and we need to get strength as men. We need to address the issue. We need to seek help often because there's a lot of hope for somebody with mental illness, but it has to be identified, assessed, and they've got to get some help. Second, lack of education. There's just not enough education with men about mental illness. Men act out their feelings, as I mentioned. But often when they're acting out their frustration and anger, it's because of a mental illness underneath that they haven't identified, don't understand. So they're just in pain, unhappy and in pain, and they're acting out their mental illness. And we have to educate them so they realize what's going on. Third, as I mentioned earlier, men have cumulative events, crises in their life that build up, and often lead to mental illness. And they often are the last to be aware of what's going on. So they may have 10 years of crises and events in their life, and they haven't connected the dots and realized they had a problem. And then finally, men have tendencies to isolate. When they're not feeling good and having problems, men have tendencies to isolate and not reach out for help. And that's the worst thing to do if you have a mental illness, is to isolate, because you're not going to get the help and people aren't going to realize what's going on.
Now let's move on a bit towards coping mechanisms. What are some negative coping mechanisms used by men?
Men use. Typical with the part of the acting out that we've talked about, aggression and fighting. Sometimes they try to feel better by just fighting and letting it out. We know that only gets them in more trouble, but that's one mechanism. That's one coping. Another is to numb your pain, and that can be through sex, drugs, or alcohol. If I numb my pain, I don't have a problem. And we know that's not true. You're just creating more problems for yourself, but that's a common coping mechanism. And the third, we've already talked about, isolating. That's a coping mechanism. If I'm unhappy and I don't have an answer to my problems, I just withdraw from everybody, go to my man cave, and just deal with things on my own. And that usually is not very successful. And then finally, a coping mechanism is to use thinking errors, blame others for my problems, or self-centeredness, get into a self-centered, poor me mindset. But all these things are negative ways to cope with the pain men experience from mental illness.
Earlier you mentioned the importance of education. How do you see the role of education being helpful to our community when it comes to mental health?
Well, several ways. I think education can help men get past the stigmas that we've talked about and realize that there's nothing unmanly about having a mental health issue. Another thing education can do is it can let a man know their options, what they can expect from what's happening with inside them, what their options are. And when you have more options, you have more feelings of control in your life, and you feel like more that you're in control. When you don't have options, often you feel in a much worse, scary place. So I think education helps men realize their options and that there is some hope. Third, I think it relieves them of some of their self-blame. I think anybody with mental illness can start blaming themselves. I'm a bad person, or I brought this on, and get down on themselves. But I think education helps them feel better that, hey, other people have these problems. I'll get past this. There is some hope. There are options I have. Just like with any health issue, we go to a doctor to give us options. What's the best option to treat what we're going through? And then finally, it lets them know some of the expected outcomes of trauma. Many times men have trauma in their life as part of the triggers for their mental illness. And it just lets them know some of the expected outcomes of anybody with trauma, and that men do get traumatized just like women. I think men often think trauma victims are only females and don't realize what they've been through may be leading them to a lot of problems. And they have to understand what trauma does.
When you look at mental health campaigns, would you say that they target men?
So you were talking, so mental health campaigns, any specific targets of specific men groups. I already mentioned one, Black men. They're often imprisoned more in federal and state prisons. And so that's one target group. We have to find ways to be more fair to Black men coming into the corrections system, to get them treatment and education, often in lieu of incarceration. Sometimes people don't have to go directly to prison, but they could go to a place like Alvis and get treatment in lieu of incarceration. So I think there's options, but that's one group I think that's very susceptible to problems. To mention a few things, our prisons and halfway houses, as I mentioned, have become treatment facilities. We've beefed up in a lot of our facilities, and I'll just mention Alvis, that provide a lot of help for men in behavioral health. They can get a counselor and get their behavioral health issues dealt with. Substance abuse. There's a lot of help for people with serious substance use disorders. Trauma. We're giving a more trauma-informed care approach with all our staff towards clients. So I think all these things help men when they come into a place like Alvis for treatment or help. And so I don't think it's all bad sometimes when somebody gets in a treatment place like Alvis in lieu of a prison sentence, because they get more help. But even prisons are treatment oriented, offering more treatment hours. So we need to do more work at identifying, which we do a pretty good job of at Alvis, high risk and high need clients. We use what's called the ORAS, Ohio Risk Assessment System, because those with higher risk and higher need are going to need more help, more dosages of treatment to do better and feel better. So as part of our behavioral health, we look at what somebody's risk level looks like to know how much treatment to give them.
What is the perception in regards to that? Would you suggest a different approach?
So men's physical health can be helpful or detrimental to mental illness depending on what shape it's in. If I'm taking care of myself physically, it's going to help my mental health issues. If I'm not taking care of myself well physically, it's going to impact negatively my mental illness or my mental health. A good quote by Plato that I like, the following: "You ought not attempt to cure the eyes without the head, or the head without the body. So neither ought you attempt to cure the body without the mind. For no part can be well unless the whole is well." So that just kind of shows us the need to have good physical health to support our mental health. Other things that we can do to help is work on our thinking. I think we do a lot of cognitive behavioral approaches at Alvis, and I think the way we think about our health can make a big impact because our mind and bodies are very attuned to one another. So I think it's really helpful to get in positive thinking patterns and realize there is hope. No matter what your situation is, there is hope. But sometimes we have to train our mind to believe that. So I think that is very important.
As we get close to wrapping up today, I have two more questions. How does men's physical health help their mental health, would you say?
Well, I think there's several things. One is you realize as a counselor or as a psychologist, you're as susceptible as anyone to mental illness or mental health issues. And I think you realize that we all have to take care of ourselves to be in our best mental health. Second, I really am an advocate of counseling. I believe that strong people know when to seek help. And I don't think there's anything weak about seeking out a counselor if you're going through a rough time in your life. So I'm really an advocate, especially for men, to take a chance, because if you find a good fit with somebody, it can make a huge difference in getting some help and counseling. And then the other thing I've realized with your mental illness or mental health, you need good friends in your life, a few good friends that you can talk to about anything. And I've realized as a psychologist, I need my friends to be able to bounce ideas off of and talk about anything that's going on. And if you have one or two people like that in your life, you're very, very blessed. If you don't have people like that in your life, I think you should seek a few people out, because men need men. Men need men. And I've realized that.
But not least, what has learning about mental health done for you, for your own mental health?
Yeah, a few things. Realize that everybody has periods in their life where they could benefit from strengthening their coping and maybe even from some professional counseling. It's not weak to go through a period of your life where you need some help. In fact, I think it's strong if you can reach out when you need it. Second, it's not unmanly to seek help. Seeking help if you have a mental illness or even just think something's wrong, not quite right. Seeking help can improve your relationships, improve your quality of life. 3, people always need to be heard. So try to be there for friends when they're in crisis. Nothing means more to people than you listening to them and being there for them. And then finally, if you do end up with a problem that affects daily coping, things don't have to end up bad or terrible. Go to an area mental health center like Net Care for Columbus and get an evaluation. Educate yourself to what's going on with you and what your options are. Mental health does not have to ruin your life. It actually can strengthen your mental health just like your physical health. There's a big parallel. And remember, it's holistic. So the best you handle your mental health, the better your physical health will be, and vice versa. Have compassion on yourself. Seek out help. Nothing wrong with that.
In terms of specific, kind of you specialize in the DD area here at Alvis. How would you say that are their main challenges on that matter?
Yeah, those with developmental disabilities have some unique challenges when we talk about mental health. It's not uncommon for them to have a mental health problem. We see a lot of them with attention deficit problems. Depression is common with the developmentally disabled. So some of the problems with those that have mental health problems is trying to keep their medications current. They really need a good psychiatrist to work with them to make it work. And often you have to be creative with funding options because funding for medications, especially that are expensive, can change often. Second, due to their cognitive deficits because of their disability, they need help in education and understanding what's going on with them. They need a lot of repetition and a lot of people working with them to educate them to what's happening. Third, some of the mentally ill that have developmental disability do better with monthly or bi-monthly shots to get their mental health shot rather than just taking pills. Because some of them are not good at remembering to take pills, and a shot can last a couple weeks to a month, and prefer to do it that way. Connect dots. Because of their disability, they often have trouble connecting how feelings and behaviors are related to their mental illness. So sometimes you have to help them connect the dots. And then finally, we're lucky at Alvis. We can provide services in-house. The more services you can provide for one roof really helps the population. So they can come over and get their behavioral health counseling, see a psychiatrist, and get everything up within one, which is very helpful for that population.
Well, thank you so much for speaking with us today, Dr. Shively. It's always a pleasure talking to you.
You're welcome.
If you'd like to learn more about Alvis and its stories, you can find our website at www.alvis180.org, where you'll find more information as well as links to our blog, Life at Alvis. You can also follow us on social media. Our handle and hashtag is 180degree impact. Thank you for listening to 180 Boom, an Alvis podcast. Please come back to hear more stories.